Okay, great. Welcome, everyone. My name is Peter Kelly. I'm with the Department of Education Early Childhood Development, representing the Center of Excellence for Health here today. So we're excited to launch our Allied Health Week. And our first speaker today is Emily Theriault. So Emily will be speaking about her experience with the pharmacy technician profession, as well as providing information about the 2-year diploma at the New Brunswick Community College. She will also be speaking about the role of pharmacy assistant, which is a 1-year certificate program at NBCC. So we're thrilled to have Emily here today, and the floor is yours.
Thank you, Peter. I'm just waiting for my slide to come up. Can you guys all see that? We're good.
Yeah.
Perfect. So as Peter said, I'm a pharmacy technician. So I'll go over the education and training that are required. I'll go over the programs that we offer at NBCC and just a few tips and stuff for students who aspire to be a pharmacy technician. So I'll go a little bit over about me, some personal skills that may be needed, our portfolio, the training and education required, work experience, and then any parting word of advice. And like Peter said, if you guys have any questions during the presentation, please feel free to put them in the chat because he will be monitoring it. So my name's Emily Theriault, like I said. When I was in high school or even middle school, I didn't really know what I wanted to be. I knew I wanted to work in the medical field, but being a nurse or working with bodily fluids was not really my thing. So I did a lot of research. I did a lot of daily going to see what the job entails and just seeing what was for me. And I came across pharmacy. So pharmacy was really interesting because I hadn't really thought about it. When I'm in the pharmacy, I work at the hospital, and it's a lot different than your typical community pharmacy. We'll dive into that a little bit as we go on, but that was really the part of healthcare that I was looking for. So I really fell in love with it, and I knew that's what I wanted to do. So I took the program at NBCC a few years ago now, and now I'm teaching there. So it's kind of a whole 360 moment. When we're talking about skills that may be needed for becoming a pharmacy technician, one of the big ones is attention to detail. So that one's really important when we're doing everything. Sometimes a patient will have a blister pack medication, so they come in a little card and each slot has a hole for their medication. And when you look at your medication and you count them, you want to make sure that they're accurate. And sometimes they're a little bit easier because each pill is a different color, but you might also have the pack that has all white pills. So you need to pay really close attention because some might have a score line, some might have different writing. So you really need to pay attention to that. When we're making specialized products like creams or oral antibiotics for children, we want to pay attention to detail to make sure that we're adding the correct amount of water or ingredients so that the patient is receiving the correct dose. We don't want to underdose them or overdose them. When we're talking about attention to detail, it can be sterile preparations as well. So when I work at the hospital, I mix IVs, so any medication that goes into your veins. So there could be antibiotics in there could be steroids, there could be a variety of things. So it's really, really important that we're making attention to detail in these cases because it's going directly into your blood. We could do medications that go into your spine or another one. Sometimes we'll even do some eye drops. So those are all things that we want to pay close attention to. The other one that's really important is empathy. So that's something that you'll need whether you're in community or in hospital. In hospital, you're not directly with patients as much, but you do sometimes do a medication history with the patient. So we'll go to the patient's room and go over their list of medications and see what they're taking and how they're taking it. You want to make sure you're really empathetic because you never know what the patient is going through or what they've just been told. They might have been told their worst news of their life. So it's really important to take the time and listen to them, even if it's not related to your job, it's always nice for them to have someone to listen to. When we're talking about your regular pharmacies, so like Shoppers or Lawtons, patients come in and sometimes they're just having a bad day. Their insurance isn't working. They need this medication right away. So it's important to be empathetic in that way too. They could have also just gotten the worst news of their lives and they're coming in to get the medication that they need for their treatment. So we always want to be very empathetic. The other one that we really see is teamwork. So whether you're working in the hospital or in the community pharmacy, you're always going to be working with a team. So the team usually consists of pharmacy technicians, pharmacy assistants, and also pharmacists who each have their individual role. So without the team, we'd be sinking. So you need to work together. You also sometimes work with people outside of your profession. So you could be in contact with a doctor, you could be in contact with the nurse practitioner, you could be in contact with a dietitian if you're working in the hospital. So there's a variety of people that make the team for the patient. So when I'm talking about myself, so I'm the coordinating instructor for the pharmacy technician, pharmacy assistant program at the New Brunswick Community College here in Moncton. So I've been with NBCC for 3 years. Before I worked with NBCC, I did work in community pharmacy and in hospital, but community pharmacy wasn't really for me. So I stuck with hospital. So I still do hospital um, monthly. So I do my 1 week in a month. I really love teaching and I'm really passionate about my career as a pharmacy technician. I love sharing it with others. I often had students that would come in and be like, "You love your job." And I was like, "I really do." So the most rewarding part of my job as an instructor is that you get to see the students understand new concepts. So they come in and they have very little training, or some have worked in a pharmacy, but they get to see all of that additional stuff and they get to develop those skills. So as they learn, you slowly get to see them become a pharmacy technician. When we're working in a pharmacy, it's really amazing to see how patients understand what they're taking because a lot of the times you'll have patients coming in and they don't know what they're taking. They're just taking their medication because the doctor told them to. When the patient knows, or when you have the time to sit down with the patient and go over their treatment plan, it really helps them be compliant. So really helps them take their medication, and that usually will help their treatment plan. So it's really nice to see that. One of the most challenging thing would be juggling multiple tasks at the same time and being very focused at the same time. So if you're working in the community pharmacy, you could have a patient at the cash, a patient at drop off, you're checking a prescription and the phone is ringing, but you got to focus on just finishing your check. That can be challenging at times, especially if it's very busy. And the same thing in the hospital. You could be mixing an IV and you have 3 new stats coming in, and you're trying to measure your medication accurately. So sometimes it can be a little overwhelming, but we work as a team, so that really helps. When we're talking about skills needed for the profession, communication is a big one. So, like I said earlier, you're really working with a variety of different team members. So, you want to make sure that your communication is clear and that you're all on the same page. A lot of math is another one. Collaborative practice, so you'll be working with different professions. You want to make sure that you're professional at all times. Um, Attention to detail is a really important one, and organization skills is also a great one because you'll be given 20 things to do at once, but you got to prioritize them. So if you have 5 stats or 5 medications that need to be done right away, I start with the one that's the easiest and quickest to do so that you can get through all of them as fast as you can. And then problem solving is another one. So you're going to come across problems and you're going to have to deal with them as they come up. So that's an important skill to have. When we're talking about relationships, we'll be working again with the assistants, other technicians, pharmacists. You can be working with your patients, other healthcare professionals. So, like I said, like a dietitian, a nurse practitioner, a physician. So those are all people that you could come in contact with. When looking back, you learn from your experience. So you don't need to have everything figured out right now. You can have multiple careers throughout your life, and it's not wasted. Like your education's not wasted. When I teach, I had a student last year. Um, and my student last year, she used to be a personal support worker, and it just wasn't for her. So she ended up taking the program with us. So this was her second career. So it happens that she had I'm just trying to find my spot. There we go. There. So she had the knowledge before. She had some knowledge of medication, not all of it, but she knew some of them, and she was able to like take those skills and bring them to her new career. Um, so I've mentioned working in a community pharmacy and a hospital pharmacy as well, but there's also long-term facilities, so long-term pharmacies. So those are more not private, but when you walk in, you wouldn't know there's a pharmacy in the back. So when they're talking about long-term pharmacies, they usually have a contract with different nursing homes. So they will contract out all of their medications to the long-term care facilities for the patients to have. So they can do blister packs. They could do a unit dose medications that comes in a little sachet and there's a medication in it. It's really up to what the nursing home needs, but these pharmacies have the contracts and they provide all the medication needed for the pharmacy or for the long-term care facility. There's also specialty pharmacies. So here in Moncton, we have Ford's compounding pharmacy and we also have Mapleton Pharmacy. So they'll have products made for you specifically that aren't necessarily available on the market, or if it's available on the market as a tablet, but you can't swallow a tablet, they'll make it into a liquid. They can make it into whatever you need. If the doctor prescribes a nasal spray or a eye drop or something that's not available, they can make it. There's also the government jobs. So we have one in Moncton here, and it's with the prison. So the prison pharmacy is not in the prison. It's here in Moncton, and they provide all the medications to, I think it's a prison in Dorchester, but I'm not 100% sure. It could be more than that. So they get all the medications ready every day and they send them out by truck to the prison. There's also insurance companies. So insurance companies such as Blue Cross or Manulife, they will be hiring technicians, some assistants to do insurance claims, to look at the drug formulary, see what's on the medication list, and have a look at that. There could be drug wholesalers, so who we order our medications from. So our big one is McKesson. So McKesson does hire assistants and technicians, and they have a variety of jobs. They have their own specialty pharmacy for expensive medication. They have supplying drugs to pharmacies. So they have different areas in their facility that technicians or assistants could work at. And then there's also pharmaceutical companies. So let's say Tylenol. So you could work for Tylenol, you could be your drug rep, go around, promote the Tylenol medication. There's different areas in the drug company that you could work for. So those are different career types that we can see when we're talking about pharmacy technician and pharmacy assistant. So when we're talking pharmacy technician, so that's a 2-year diploma program. So once you're done your 2-year program, you would need to write your national exams, need to write your provincial exams, and then you would need to complete a structured practical evaluation. So that's like a manual, and it has, I think it's around 40 questions, and they're very big questions, and you have to perform 500 checks. So those checks mean that you've checked a prescription, you've checked the product, and everything matches, and they have to be all accurate. If you get the last one wrong, you're on 499 and you get it wrong, you need to restart those checks. So we usually have to pay really close attention. As a pharmacy technician, once you do all of that and you get your license, you would be able to technical check a prescription, so verify that the information on the prescription is accurate, complete, and has all the information required. And you could also do the final check, so make sure that the medication that's listed in the computer system matches what's in the bottle, matches the patient's profile. We can also show patients how to use different devices. So it could be a blood glucose monitor. So when you test you poke your finger and you test your blood for blood sugar. We could do a blood pressure monitor cuff. So when they put it on the arm to test your blood pressure. So different device demonstrations. We can also assess the patient when they come in for which device would work best. So there's a variety of different devices. So we know how each one work. When the patients come in, some have a hard time reading, so we might recommend a certain device because it's got bigger text. Some might have a hard time seeing, so we might recommend another one because it has a light on it. So it depends, but we can assess for that. We can also receive verbal prescriptions from the doctor. So when the doctor calls into the pharmacy and says that they want certain prescription for a certain person, we can take that. We can also transfer prescriptions. So if a prescription's at our pharmacy, we can send it to a different pharmacy that the patient has requested. We can develop master formulas for compounds. So that means if the doctor prescribes a product that's not available and we have to create it in the pharmacy, we can create the formula based off of different resources that we use. And then we can also take additional training after all of that to do intramuscular and subcutaneous injections. So intramuscular, like think of you like your flu shot, what else? Your COVID shot. Subcutaneous, we don't see as much, but the chickenpox vaccine goes subcutaneous. So into your like your fatty layer into your arm here. When we're looking at pharmacy assistant, that's a 1-year certificate program. So once you're done pharmacy assistant, you're ready to work. You don't have to take any additional exams. You're not licensed. You don't have to worry about all of that. As an assistant, you can do entering prescriptions in the software system. You can fill the prescriptions. So when the prescription set comes out, you can count them out. You can manage the inventory and bill insurance companies. So all the things that the assistant can do, the technicians can do, plus everything that I've mentioned. When we're talking about our program, you would take pharmacology, math, communications for healthcare professionals. We'll take law, so we'll do federal and provincial law. We'll do ethics. We do distribution of medication labs, so we'll do community labs, long-term care labs, and hospital labs. And we have a lot of on-the-job experience. So you will be in the hospital and in a community pharmacy for, I think it's 12 weeks now of the community and 8 weeks of the hospital. So you'll be out on practice, learning on the job training. Once you've graduated, like I said, pharmacy technicians are going to take their national exam, take the provincial exam, do the structured practical training. You'll need your CPR to be registered, and then you can do the injection training if you want that additional training. And it's completely optional. Some patients or some people don't want their injection training at all, and some people do. It's completely up to you. It's not forced, but you have the option. So here's an example of the hospital. So here is the dispensary, so where the medications would be prepared. So in these little bins that we have, there we go. So in these little bins here, they're all filled with medication. So like I said earlier, in unit dose packaging, so the little sachets with a little medication in it. So they'll get a label that comes out, and she's entering the prescriptions here. So she would be entering them, and then they'll come out on a little label, and the label will say the patient's name, the medication strength, and how many of them. They'll have other information, but then the workers will know which one to grab. So they'll go grab the medication from the shelf and put it into a little bag to be checked by a technician. So that's the dispensary, so the main area of the hospital pharmacy. This is in the sterile room at the hospital. So there's different sterile areas. So this one would be your typical sterile area. So where you're preparing medications for intravenous, so going into your veins, you could have medications for epidurals, things that are sterile but are not toxic. And here's another example of her. She's preparing them in the hood. So you could be standing or you could be sitting. And then here's an example of toxic medication preparation. So they have a different hood. So when we're talking about toxic medications, it's like toxic to us as we mix it. So it could be, a lot of it is cancer medication. So for chemo, they prepare it in a specialized hood where it lowers our exposure risk. And they often will have different set up. So they have a closed system transfer device, is what it's called, and there's no needle exposed. It's just two plastic tips that hook onto the vial where the medication is and the syringe, so that our exposure risk is even reduced, and there's no chance of us poking ourselves with the needle of the cytotoxic medication. So those are the hospital side of things. This is an example of long-term care. So like I said earlier, the long-term care facility, you don't really deal with patients, but this is an example. And they have the PackMed here. So the PackMed is the machine that packages all the medication in the little unit dose sachets. So here they would have one person filling the machine and one person checking them. So the person filling them would go into the system. They'll have an error message. You need to fill up this pocket. So they'll fill up the pocket with the bottle of medication. And then once all the sachets are filled, the second person will go in and check them to make sure that they're accurate. What it says on the sachet is actually the medication that's in it. So those are different types of pharmacies. And then we also have your community pharmacy. So pharmacies that you're used to typically seeing, Shoppers, Sobeys, Lawtons. So here they have a person taking a verbal prescription and one person looking for product on the shelf. There's also two people here. So one is counting tablets. So whatever it says on the label, it's the same concept as in the hospital. They'd have a label with the patient name, the medication name, strength, the quantity, and then you scan the bottle and it'll tell you if it's the right bottle. And then they'll count it out. And then here, an example of a worker, I think it might be an assistant, handing the prescription to the patient. So that would be at pickup when you go in and pick up your prescription that's prepared. When we're talking about work experience, what you would do in a typical day as a pharmacy technician, you would prepare medication. So this is actually taken in our lab. So we've got two students and they have their medication bottles and they're counting out pills. So when we have our lab, there's 5 different stations set up. So we usually have 2 to 3 people per station, and those are your stations for the 2 years. So you have your own workplace and you practice working in a pharmacy, you practice making medication. So all that stuff happens in the lab, but that's something that you would do in your day-to-day. You're also going to interact with patients. So here, that's actually me giving an injection to a patient. So I think it might have been their flu shot. So you'll be interacting with patients, and whether you're working in community or in long-term care or in hospital, you'll still have that interaction with patients. It might just look a little different, but you will have that every day. The next one we have often is mentoring. So you'll have, like I mentioned, there's our students are going out on practicum, they're on the job, so they will be coming to the pharmacy and someone's going to have to mentor them. We'll often have pharmacy students, so pharmacists that are going to school, we'll have them. New employees often come in. If you're a technician, you're mentoring different technicians, you're mentoring different assistants. If you're an assistant, you'll be mentoring assistants. Sometimes we even mentor the pharmacist because we see stuff that they don't necessarily see. So when they're new, they come in and we help them out, we mentor them, we show them how things work. And then the last slide I have, I just have a little quote here. So you don't need to see the whole staircase, just take the first step. So you don't necessarily need to know what you're doing. I know it can be very overwhelming and hard. I was in your position a few years of, well, more than a few years now, but it's very hard to see. And you'll be amazed with all the opportunities you have. Just take the first step and you'll be exposed to even more things that you know or even possible. Um, Being a technician really allows us the opportunity to help others daily. So no matter what your place of work is, currently when I'm teaching, I'm helping students learn new concepts, new skills. If I'm working in the hospital, I am helping the patients learn what they're doing for their medications, get their medications ready. And then even in community, you're helping them. We're always preparing medications and or administering injections to the patients too. So they're usually very thankful for their flu shots. They're usually pretty happy, but we're part of a big New Brunswick healthcare team that makes us proud. So those are my thoughts thoughts. And I do have my email at the bottom here if anyone has any follow-up questions. I don't know if there's any questions in the chat, Peter.
Not yet, but I will open up. Oh, I think there is one question here so far.
Yeah.
And if anyone else has questions, feel free to add them to the chat, and I'll be sure to ask Emily. So, first question, did you always know you wanted to work in the health sector? And did any school or work experience you had prior to working in this field help you build the skills that have contributed to your success?
So like I said earlier, like I was really not sure what I wanted to do. Like I wanted to be everything and anything. Every time someone would ask me what I wanted to be, I had a different idea. So when I graduated high school, I actually went to university to become a teacher. And it just wasn't for me. I wasn't enjoying it. I didn't like the university atmosphere. So I really had to take a step back and say, okay, like what do I want to do? What are my interests? What am I passionate about? And when I came across the pharmacy technician, it was like a good, happy medium. I was helping patients, teaching them how to use their medications, and being exposed to that. And then when I was offered the job as an instructor, I was like, that's perfect. That's combining what I want to do, teach students, teach people, and still work in the pharmacy. So I was still able to be exposed to helping and teaching. And what was the other part? My skills. So, oh yeah. So like I said, I took my first year as a teacher and it wasn't for me, but I bring that to my practice. I really show patients how to use different devices and different monitors. And I bring it to my practice as an instructor by teaching the students and helping them develop their new skills.
Great. I have a question, just
Mhm.
to tell some others in the chat. So you mentioned how you worked in community as well as the hospital. Can you kind of talk to the pros and cons of each setting, like what you
So
enjoyed about each setting,
yeah.
and what
So the
and I guess
pros
what
and
drew you to the hospital setting?
what drew me, yeah. So the pros and cons are really dependent on each person. I like the fact that when you're working in hospital, it's always different. So when I work at the hospital, I could be one day doing IV medication and the next day I could be in the dispensary. And you're not always working with patients directly, but if you are, for the most part, they're happy to see you. So you don't feel like a burden. When you work in community pharmacy, you often get people that are frustrated or people that their insurance isn't working, the doctor didn't send in their prescription. So you're often having that conflict that I just didn't like. And you're often, depending on where you work, doing the same thing every day. And that was just something that I didn't want to do. So when I really looked, I tried both and I was just like, you know what? Hospital's for me. So but I do have some colleagues that are like, I cannot stand working in the hospital. I don't know how people do it. I'd rather work in the community pharmacy. So that's really where I was.
Great. Thank you. A couple more questions have
Yeah.
popped in the chat. Uh, do you know the rate of students who get a job after they complete their training?
Yeah, so actually, all our students that graduated last year in June have jobs. They had jobs before they even graduated. So a lot of them, because they go out on practicum so much, they'll get hired on from practicum and just get a job, usually year one, sometimes at the middle of year two, and they just keep that job. So all of our students are currently working towards getting their license and they all have a job.
That's awesome. That's great. What do you recommend for students to take in high school that would be helpful?
I would take biology and a chemistry class, and the math, focusing on the math. They don't need I can't think of what it is, like the high math, the calculus, just the regular math is good. But we do a lot of calculations, so that's important to have.
Great. Question around the practicum, is it paid?
So the practicums aren't paid. So the practicums are during school hours, so Monday to Friday, and we usually do 8:30 to 4:30. So it's technically like they're going to school. So they're not paid, but we do have students who work after their practicum. We also have students that would rather do practicums on the weekend and work during the day. So if they'd rather do their practicum Thursday or Tuesday to Saturday and work on Monday, they can do that too. We're flexible as long as they get their hours in.
So it'd be very similar to like high school co-op type program.
Yes, yeah, exactly.
Great. Yeah, there was one question in the chat that I think was answered already. Are there any other last questions, I guess, for Emily before we wrap up? Okay, well, if not, thank you very much, Emily. Definitely
Yes,
enjoyed
thank you
it.
so much.
And I think it was beneficial. So this will be, this is recorded and it will be shared on our website. So again, if you want to share with other classes, just a reminder to any of the educators on the call that there is a poll. If you've not filled it out, please do so. If not, really the information we need to know on our end is which district you're from, which school you're from, and how many students are in attendance. So you can feel free to put that in the chat or answer the poll. So either way is great. But thank you very much, Emily. Appreciate your time, and thanks for everyone for being on the call today.
Thank you. Have a great day.